Hello everyone, we are from SGDB 8 and in this occasion we are going to present our student project crash injury or syndrome. Next slide. And this is our member. Next slide.
Thank you for the opportunity. I'm Dewai Prameswari with last 3 digit of the registration number is 101. Cross injury is an anatomical consequences linked to direct trauma from compressive force. It is commonly happen during natural disasters such as landslide, floods, and earthquake, and also human-induced calamities such as traffic accident, terrorist attack, and also military conflicts. It is very fatal because it leads into organ dysfunction, including acute kidney injury or even fatality or death, with 50% of cross syndrome patients needing renal replacement therapies. Advancement in research over the past decade has substantially enhanced the comprehension of crush injury or syndrome. The objective of this student project is to furnish comprehensive information on crush syndrome or injury. Here are the problem formulation. Here are the general purpose and also the specific purpose of this student project. These are the theoretical benefit and also the practical benefit from this student project.
Okay, we'll continue. My name is Siputu Pranadia Vidya Sagara with the last 3 digits of my student number are 059, and I will respond about the definition of cross injury and cross syndrome. So, cross injury is defined as injury to an area of the body in the form of muscle swelling and or neurological disorders caused by direct physical trauma or compression in that area. Disasters such as debris flows, earthquakes, terrorist attacks, explosions, local wars, mine disasters, and other accidents are generally the main cause of cross injury. This injury is known to cause edema and damage nerve, soft bone, and muscle tissue, especially in the extremities. Meanwhile, cross syndrome, or also known as traumatic rhabdomyolysis, is a complication of cross injury that describes the condition of the body that has a cross injury, also accompanied by organ dysfunction as a result of the release of skeletal muscle intracellular contents such as myoglobin, potassium, and phosphorus into the bloodstream when the integrity of muscle tissue decreases.
Hello, my name is Misa Karnaputri and my last 3 digit NIM number is 167. I will explain about epidemiology of crash injury syndrome. Every year, millions of people around the world experience natural disasters like earthquakes or hurricanes and human-made disasters like terrorist attacks, plane or train crashes. The most recent example is the 2023 earthquakes that struck Turkey and Syria, resulting in more than 47,000 deaths and the displacement of millions of people. In one study, it was reported that among earthquake victims, the reported crash syndrome rate was 2 until 15% and the mortality rate was as high as 48%. Other victims experienced limited survival due to the degree of dysfunction of the kidneys and supporting organs. The number of earthquake victims who require hemodialysis varies widely from 0 to 75%. And several studies have tried to study various factors that can influence the final outcome of earthquake victims with crash syndrome. Some relevant factors include the quality of infrastructure, decision, routes, the arrival of rescue crews, and many more. In addition, it is noted that up to 80% of patients who suffer injury from being hit die due to asphyxiation or severe head injury. Of the 20% of patients who arrive at the hospital, 10% experience an uneven full recovery, and another 10% experience crash syndrome, latter as a result of non-catastrophic condition, especially trauma-related crash syndrome. 10 to 20% of patients develop renal dysfunction, with 1.5 to 2% of patients requiring dialysis for oliguric renal failure. Significant rates of renal impairment were associated with height-risk variables, including delay in hospital admission of more than 12 hours, low baseline hemoglobin, severe pigmenturia, high serum creatine kinase, and many more. Thank you.
Alright, I will continue for the presentation and I will explain you about the etiology of cross injury or syndrome. But before that, let me introduce myself. My name is Tabitha Trina India Brusmbiring with the last 3 digits of student number 232. So, the human body, particularly the muscles, can sustain direct physical trauma and compression, which is intimately linked to the genesis of cross injury or syndrome. This illness results from chronic tissue deterioration and is a severe systemic expression of trauma and ischemia targeting soft tissue, especially skeletal muscle. Cross injuries can result from a variety of incidents, including landslide, building collapses, explosion, terrorist attack, combat, and motorcycling accidents. The lower extremities are the most frequently injured after being struck. Muscle cell damage resulting from decompression after ischemia reperfusion or IR injury is the hallmark of CRUSH syndrome. As soon as 1 hour following an injury, onset may happen. The development of novel, practical, and effective therapies for the early management of CRUSH syndrome at catastrophe sites has become necessary in recent years. That's all from me. Thank you.
Okay, thank you for your time. But first, allow me to introduce myself. My name is Pulson Eka Putra Tanuwijaya, with the last 3 digits of my student number being 084. I will be giving a short explanation about the pathophysiology of crush injury or crush syndrome. So it generally resolves around a self-perpetuating edema and ischemia cycle from the state of nothingness to basically tissue death. So for crush injury, force compresses the blood flow and decreases the oxygen supply to damaged tissues, which in turn releases lactic acid, potassium, myoglobin, and purines into the bloodstream, into the body, basically. If in time the force is decreased by some other measure, the blood flow will continue into the damaged tissue and the body will start healing itself. But in the worst case scenario, it can cause swelling, and which is in turn results into muscle necrosis and neurologic dysfunction. Swelling can also lead to pressure buildup, which if it reaches over 30 mmHg, results in muscle ischemia. Maybe that's all that I can say for now. I'll let my friend here continue.
Hello, my name is Uday Andarustri with trade plus digit number 119. Today I'm going to talk about crush injury syndrome and symptoms. First one is skeletal muscle compartment syndrome. So skeletal muscle compartment syndrome is a hemorrhage or injury inside the veins and fascial group that can raise pressure within the skeletal muscle compartment. Skeletal muscle compartment syndrome indication and symptoms appear in these tissues when the tissue fluid pressure inside the compartment exceeds the pressure of the muscle and perfusion of nerve capillaries within the compartment. And this condition also can lead to ischemic in the affected area. Next one is ischemic reperfusion, which is are injuries arise from acute inflammation, which can be caused by a variety of causes during tissue reperfusion after an ischemic period. Next one is acute kidney injury. An early inflammatory reaction is set off when blood reperfused into ischemic muscle, and neutrophils are the first to infiltrate and separate the damage to the muscle. Acute kidney injury and metabolic disruption are caused by crush syndrome, a systemic manifestation of muscle disintegration whose contents are discharged into the bloodstream. Next one is acute respiratory distress syndrome, which RDS, and when combined with followed by vasoconstriction, distributive shock, fat embolism from lengthy bone fractures, and severe tissue necrosis, ARDS may develop into crush syndrome symptoms. Next one is asphyxia, because of a large size and pressure in the thoracic cavity and superior vena caused by initial crush injury to the chest. Asphyxia can occur when this pressure is combined with attempts to breach via closed glottis. It can cause nerves in the head and neck to rupture. Extremity crush injury. The crush injury involved the extremity. Symptoms appear in a variety of ways, including swelling, purpura, bleeding, close or open fracture, neurovascular damage, and the reach of severe extremities. Hypertension. In the early hours after the initial injury, hypertension occurs, which is associated with severe inflammation, organ damage, bleeding, distributive shock, persisting, and brain concoction injury. The last one is organ injury. For example, direct torsion injuries can result in palliative condition, Including hematoma, pneumothorax, pulmonary contusion, myocardial trauma, solid organ injury such as chronic or liver laceration, polyphysis injuries, the fractures, and pelvic fractures. Injuries from projectile penetration are an additional history. That's all from me. Thank you.
Okay, let me to introduce myself. My name is Bilo Kesoparta. The last three digits of my number is 080. I will explain about complication of crash injury or syndrome. Complication arising from crash injury or syndrome significantly increase the risk of mortality. This complication can include acute kidney failure, compartment syndrome, ventricular fibrillation, and multiple organ failure. The most common complication, acute renal failure, is often a consequence of rhabdomyolysis. Muscle damage leads to release of cell components and intracellular fluid, causing myoglobin-induced damage to the renal parenchyma and resulting in acute kidney failure. Compartment syndrome, characterized by increased pressure within the osteophyseal compartment, leads to ischemia and tissue necrosis, with the anterior compartment of the foot being a common site. Ventricular fibrillation may arise from metabolic abnormalities and hyperkalemia, potentially triggering cardiac arrest and subsequent death. In severe cases of crash injury or syndrome, electrode imbalances and significantly circulatory dysfunction can lead to life-threatening multiple organ failure. That's all from me. Thank you. Hello everyone, my name is Putri Sarananta with student ID number 021, and the next is the diagnosis. Serum creatine kinase values around more than 1000 intracellular per liter, and associated symptoms indicate crash syndrome. Normal range around 25 until 175 international unit per liter, peaking 1 until 3 days post injury. Tests are serum adolase, myoglobin, lactate, AST, LT, LDH, and serum urea or creatinine rise after exercise. Potassium predict dialysis need, like hypocalcemia, hyperglycemia, and myoglobinuria may occur. Monitor intracompartmental phases more than 30 mm Hg may need fasciotomy. Doppler test for limb ischemia, weight, acute compartment syndrome diagnosed by exam, and intracompartmental phases measurement. Food symptoms less reliable. Continuous pressure measurement equipment is insensitive, challenging in deep tissues, delaying diagnosis in disaster-affected communities. Next slide.
There are several options for treatment for crash injury. The first one is fluid replacement and monitoring. The initial fluid replacement within the first 6 hours is very important. The best fluid to give is 2 liters of IV or IO or crystalloids and continue at 1 liter per hour. To monitor, do a 15-minute to hourly vital signs examination and urine output is documented on the flow sheet. Another management of crash injury is to maintain the effective kidney function. The urinary output should be at least 300 ml per hour, as fluid sequestration inside damaged muscles may be as high as 4 liters. The third one is dialysis that may be required for up to 15 days, at least twice or perhaps 3 times a day. For patients at high risk for hyperkalemia, prophylactic dialysis may be needed. The fourth one is hyperbaric oxygen. The typical dosage is 2.5 atmospheres, given twice a day for 1.5 hours for a week. To control the infection, non-nephrotoxic antibiotics may be needed. The best option is ertapenem, a gram IV per day. The other options are cefazolin, clindamycin, and moxifloxacin. For surgery options, laparotomy and thoracotomy are needed for wide debridement of all necrosed muscles, followed by delayed primary and secondary suturing. Fasciotomy needed for patients with clinical signs of compartment syndrome.
My name is Beningkiran Kalisal with the last 3 digits of my student ID number R152. I will explain about the prognosis of the crash injuries. So the crash injuries prognosis are varies widely, from full recovery to severe disability or death. So early recognition, proper medical management, and timely intervention are very crucial for improving outcomes. The effective management requires suspicion, clinical skills, and a dual focus on preventing complications. Mortality rates for crash syndromes depend on patient's factor and local circumstances. Patients with rhabdomyolysis-induced renal failure have a 20% mortality rate, which can increase with multiple injuries and overwhelm healthcare system.
Let me introduce myself. My name is Riandra Putranta with the last digit number is 094. I'll explain to you about the prevention of crash injury or crash syndrome. The prevention of crash injury or crash syndrome may vary depending on the situation. In the case of crash injury, early and energetic fluid resuscitation is a crucial preventive measure for crash injuries. This involves administering isotonic saline to maintain blood volume and prevent hypovolemia, which can lead to acute kidney injury. Avoiding nephrotoxic medication is another important step in order to prevent crash syndrome. Nephrotoxic medication can cause direct damage to the kidneys and worsen the effect of crash injuries. On the other hand, for freezing cold injuries, rapid warming is an essential step in preventing direct injuries from intracellular ice formation and protein denaturation. It is essential to rewarm the affected part of area in a warm circulating water bath. An adjuvant treatment for crash injuries and other acute traumatic peripheral ischemia, including compartment syndrome, thermal burns, and threatening replantation, is hyperbaric oxygen therapy or HPO. HPO helps regulate the delayed inflammatory response and raise tissue oxygenation to level necessary for the host reaction to injury to function. In the context of crash injury, HPO has been used as an adjunct to surgical treatment and resulting in early healing and rehabilitation, accelerating functional recovery. That's all from me. Thank you.
Hello, my name is Niputula Prasanti with last 3-digit number 138, and now let's talk about the conclusion. Crash injury refers to damage to a body area due to physical trauma or compression, resulting in muscle swelling and neurological issues. One significant complication is crash syndrome, which occurs when a crash injury leads to organ dysfunction due to the release of skeletal muscle contents such as myoglobin, potassium, and phosphorus into the bloodstream, causing hypovolemic shock or hyperkalemia. Crash injuries result in high mortality rates, with up to 80% of fatalities occurring due to asphyxiation or severe head injuries, and among survivors, 10 to 20% may experience renal dysfunction. Crash injuries can occur due to various incidents such as landslides, building collapses, and explosions. The pathophysiology of crash injury involves a cycle of edema and ischemia, tissue damage due to compression, and the release of cellular contents like lactic acid, potassium, purines, and myoglobin into the bloodstream, contributing to systemic complications such as organ dysfunction and electrolyte imbalance. Signs and symptoms of crash injury include superficial injuries, muscle bruises, blister, petechiae, sensory loss, myalgia, and muscular paralysis. The progression includes fever, cardiac arrhythmia, pneumonia, dark urine, oliguria, and renal failure. Crash syndrome systemic symptoms include skeletal muscle compartment syndrome, ischemic reperfusion injuries, acute kidney injury, acute respiratory distress syndrome, asphyxia, extremity crash injury, hypotension, and organ injury. Complications arising from crash syndrome can include acute kidney failure, compartment syndrome, ventricular fibrillation, and multiple organ failure that increases the risk of mortality. Crash syndrome is indicated by serum muscle specific creatine kinase level exceeding 1,000 international units per liter alongside associated symptoms. Tests for serum aldolase, myoglobin, lactate, AST, LLT, and LDH are also useful. Crash injury treatments include fluid replacement and monitoring, diuresis, dialysis, hyperbaric oxygen, antibiotics, and surgery. The prognosis of a crash injury can vary widely. Early fluid resuscitation with isotonic saline, avoiding nephrotoxic medications, rapid rewarming for freezing cold injuries, and hyperbaric oxygen therapy are preventive measures against complications associated with crash syndrome.